So Fang Jing is from Kunming Medical University. We talk about SIUC.
Good afternoon. Thank you for Taichao. You give us a very broad picture about food safety in China. Now I want to share with you a more concrete, specific study we have been doing in Yunnan province, China, and also the regional big project in which the Yunnan study is part of that regional project. We create field building leadership initiative advancing equal health in Asia. This is a regional project, and next one is the Yamo country we did is our China study. So in the introduction part, I give you two parts of information. One is about FBI, we call it FBI. Another one is a Yunnan Yamo study. And then the methodology, what kind of methodology we have been using in Yamo study, and some of the research findings and discussion. FBI is a regional equal health project funded by IDRC. The main theme of this regional project is agriculture intensification and health. We noticed in the world, also including in Southeast Asia, agriculture intensification is going on, and which lead to, of course, a lot of good aspects, but also a lot of not so good consequence on the environment and health. So several countries in this region, we work together to apply for a project, and was funded by IDRC, Canada International Development Research Center, Canada. It's a 5-year project started from 2011 until next year. We will end next year, September. We have 7 institutions in the region and beyond involved in this regional project. We have 4 objectives in FBI. One is the research. We say equal health research, trying to address the human health problems related to agriculture intensification. Then we also have capacity building in Southeast Asia country. We have 3 sub-components with capacity building. We want to build the leadership and expertise in this area of equal health. Also, the third objective is we want to engage key policy makers at local and national level, of course, regional level, to do knowledge. We call it knowledge translation, or to make the research result useful. And the fourth objective is we want to facilitate networking of networks and knowledge sharing. Now we have we call it Asia Equal Health Networking, involve a number of Southeast Asia countries in this network. Those figures show you the structure of the main component of this FBI. We have made 4 big components: research, capacity building, knowledge translation, and networking. Networking was not shown in this map. And we call it a site-based concept or approach. So in total, we have 4 study sites located respectively in 4 countries in this region: China, Vietnam, Indonesia, and Thailand. Okay, this is about capacity building. We have 3 sub-components. One is the degree training. We want to do master and PhD degree training on equal health in this region, but it's not so easy because you have to be approved by the Ministry of Education. So started in Mahidol University, Thailand. And we have future leader training It's a short training program. We've done it in each of the 4 countries. We have TOT training. We hope those trainees, they will start to teach equal health in university research institutions. We have knowledge translation, try to influence policy. We have some competencies there. This map shows you the location of the 4 study sites and the sub-theme of each study. They're all related to agriculture intensification, but with different specific research topic. For our study in Yunnan province, we focus on pesticide using. But for the study in Vietnam, they focus on how to better manage human and animal waste. And in Thailand, it's about rubber plantation expansion and increased risk of vector-borne disease, including dengue and malaria. In Indonesia, they want to work on dairy production and how the impact of dairy production, including AMR and also hygiene, this zoonotic disease. So they're all under big theme, agriculture intensification and health. Those are the name of the location of our study. In terms of governance of this regional program or project, we call it regional core groups, 7 people inside. And we have a coordinated unit located in Vietnam School of Public Health. Those are the members of the core group. And we have annual meeting to share, to exchange. Those are the logos of the institution involved. Okay, this is a brief introduction of the regional part of this project. Now I come to the specific study, which is more related to food safety in Yunnan province. The county we are working is called Yanbo County. Yeah, now I give the name, but I hope it's not make it too publicly. At the beginning, we want to do this research in this country. We are not allowed. They worry about our research will affect their selling vegetable, economic development. They just refuse us. But gradually, we worked there a very long time. They gradually accept us, but still not happy if we publish a lot research results showing they use a lot of pesticides there. Those are the partners. We said multidisciplinary, transdisciplinary. So we have Kunming Medical University, we have local CDC, Center for Disease Control. We have Yunnan Agriculture University also involved. Background, a little bit of background. Yanbo County is one of the typical rural counties in China. Since 1980s, they begin to develop a large-scale vegetable plantation as an economic development strategy. And because the weather there is warm, so they want to use weather warm to produce vegetable in winter season. And this county is famous. They got the one of the 100 demonstration counties in China issued a certification by Agriculture of Ministry of Agriculture. They give them certification saying in this county they produce green vegetable. Since 2011, we have been doing this project in this country. Here, a map shows you the location of the country. This is a map of China, and the Yunnan province is here. We border with Myanmar, Vietnam, Laos, and the Yanbo County is here. Sorry. It's in the north of Kunming City, and this map is a county. It's located in Jinshajiang is part of Yangtze River basin. Here I give you some information about the ecology, demography, and socio-economic profiles of this country. Basically, it's not too big, but it's a dry, hot valley with very little rainfall and much bigger evaporation. And the population not so big. Economic level maybe middle among all the countries in the Yunnan. And there is a very famous tourist place in this country called clay forest. You might know in Yunnan we have stone forest, but here we have clay forest because of geography and also ecological condition, a lot of erosion. So those look beautiful but very dry. And those photos show you the vegetable plantation in this country. Since 2008, the government decided to use the warm weather in this country to develop vegetable plantation. So they plant a lot of like a cucumber and onion and beans to supply 24 provinces in China, and also some of them export to other countries. But here, this strategy, they have impact on the environment and health. First is a shortage of water. We don't have, in that place, they don't have enough water. Now, grow vegetable make it even less water. And of course, massive use of chemical fertilizers and pesticides. And there is an endemic disease called fluorisis. It's because of the much more fluoride in local environment. So you make a dental fluorisis and bone fluorisis. Okay, what kind of methodology we have been using in this country, in this study? We said we use a set-based approach, which means we will work a long time in this country. This country is selected as a strategic site. We want to engage with the local stakeholders in a long-time way. So gradually we can work together to find some solutions. In terms of very concrete research methodology, we use a mixture. We could, including qualitative and quantitative research methodology. One of them we create a photo voice technique. Because when we want to try to understand how many varieties of pesticides farmers use, it's so hard. They cannot remember too many. So we give them a simple camera and train them to take photos of whenever they use pesticides. Then we analyze those photos and we identify what kind of pesticide they're using. And we also use laboratory tests, so it's very comprehensive. Since 2011, we have a lot of research fundings. Here I just share with you some of the things related to pesticides using. Of course, first is vegetable plantation since 1980s, large scale, but mostly by individual household. Every family, they produce their own. But the interesting thing is, in the last 5 years, they is rapidly increasing of large-scale plantation, which means some investor, they come there, they rent land from farmers, they form big plantation companies, they hire workers to help them. So it's changed, its way of production changed from individual to large scale, like a company type of production. And of course, both of the individual-based or company-based production, they highly rely on chemical pesticides. Interestingly, farmers, they know the harmful effects of pesticides, so they have their own coping strategy. They try to avoid the bad effect of the pesticides. And what do? They don't eat the vegetable they grow. They eat separately grow vegetable. Here the data we got from using photo voice, we followed the farmers to look at how many kind of pesticides do they use in one grow, one season tomato. And we followed the 16 farmers, and finally only 9 of them, they finished the whole process. And we found that those 9 farmers, they use 88 variety of pesticide in grow one season tomato. 88, and 76 of the 88 are fungicides, and 12 of those are insecticides. So those are the what kind of very typical. Those tables show the first 15 pesticides they use in grow tomato. Those are chemical names of those. And we investigated what kind of vegetable do they eat. We surveyed 217 farmers. You will see 77% of them, they only eat vegetable grown in their private plots. And sometimes they don't want to eat vegetable grown by them. They buy from the market. But some of them told us, I want to buy the food, vegetable grown by my neighbor, because I know what kind of pesticide do they use. But from market, I don't know what kind of vegetable, what kind of pesticide they use. I don't want to eat that. The majority of them, they have a safe protection way. And we did a laboratory test to test the residues of pesticides in those vegetables. We collect waste sample. Quite interestingly, we collect 557 from private plot, and some of them from farmer field, some from the market. They buy from market, and we find that their safe protection measure do have some effect, because the percentage pesticide residue is only 6 point, but the farmer vegetable sample from large-scale farmer field is 13, and the one bought from market also similar to the sample from the large farmer field. So they do have some effect, but still they cannot avoid being infected. Still, 60% of the vegetable samples they eat is contaminated. And we noticed a new professional group appeared. We call them agriculture workers. Before they're working in their individual farm, now they're working in the big plantation company, either daily or seasonal or long-term. But the occupational health protection of this group received almost no attention from nobody. Nobody paid attention, but they have great exposure to pesticides when they're working at home. There were very little protection when used pesticides. Also, they don't. The local health workers or health sister, they don't know how to dealing with the pesticides-related health problems. They are asked to dealing with chronic disease and other things. They paid no attention to this problem. Okay, here 2 pictures show those agriculture workers. Majority of them are women than men, because men can get a better paid job in other places. Women left at home, so they like to work in those plantations. They can get more cash than working in their own land. Some of them are ethnic minority group from mountainous areas. They moved to here working in those plantations long term. Yeah, those are the okay. What kind of safe protection measures when they work in the plantation? Whether they wear mask, whether they wear glove or wear hat, not much. Okay, I want to use this single diagram to show you stakeholders in this system. We have a red box and blue box. Blue box means we already work with, we did a survey, we did investigate, we talk with them, try to understand them. But the red box means we haven't yet. But they do, we found they do play a role in this system. So we have producers, including smallholder and plantations. And we have pesticide seller. And we, including wholesale and retailer. We have producer. We have a plant protection, which is part of belongs to Agriculture Bureau. We have, from health system, we have health bureau, we have hospital, we have maternal and child health, and we have consumers, we have vegetable sellers, wholesale retail, and we have mass media. All those stakeholders, they play a role in the current situation, but we haven't got enough energy and time to work with those stakeholders. Okay, I think I stop here. This is a picture we took from the site. They just use it without any or very little protection. Okay, thank you.
Thank you.